Hello everyone. Today we're going to be walking through how to do the HCG syringe preparation. When you first get your package from Wells Pharmacy, you're going to be receiving this box right here, which has the actual HCG in it, a mixing syringe. We're going to give you enough syringes, these are insulin syringes, enough syringes to last for the entire cycle, whichever program you've decided to do, the shorter or the longer, and enough alcohol swabs as well. So the first thing that you're going to do is open up the box that you've gotten from from Wells Pharmacy, and basically you're going to find two things in here. This is the actual HCG, which at the time that you receive it is in powder form. It has not been reconstituted, which means mixed. And then they're going to give you a mixing solution of sodium chloride. What we'd suggest is that you not actually reconstitute the sodium chloride with the HCG until you're actually ready to use it. The reason being is that the HCG, once it's been reconstituted, will last about 30 days. So you don't want to do that until you're ready to begin the program. So let's say it's the day before your program or even the day of, and you're ready to get started. So what you're going to do is you're going to take your mixing syringe, and this is only used for the actual reconstitution of the sodium chloride in with the HCG. So you're just going to unwrap it, and you'll see on the side here that it has a 5 ml measurement. That's the amount of sodium chloride that you're actually going to be mixing in with the HCG. So the first thing you're going to want to do is remove the caps to both of these containers. So you just simply click them off. Hold on one sec, this is like harder to get off. And then you're going to take the alcohol swab and wipe the top to make sure it's sterile. For the sodium chloride. Okay, so the first thing you're going to want to do is to remove the cap to the needle, and you're going to insert it into the top. You'll see this is a rubber top. You're going to insert that into the top there in the center, and then just simply turn the bottle upside down, and make sure that the tip of the needle is always submerged under the liquid, and just simply pull the rubber plunger back to 5 mLs, and you'll see that it's gradually filling up the syringe. Okay, so you're going to go to where the rubber is actually down to the bottom to the number 5, and once you're there, you're going to just pull the needle out. And the next step is to actually take this needle and now inject it or insert it into the lid, let's see the rubber lid, of the HCG. Once you do that, it will actually just begin to do it on its own. You see I don't even need to push the plunger in. Okay, pull the syringe out, return the cap to the needle. And then at this point, what you're going to do is you're going to gently roll the HCG. You do not shake the bottle. Just gently roll it so it gets properly mixed. You can do this for just for a little bit. And then basically your reconstitution is complete. From this point forward, the HCG needs to be stored in the refrigerator at all times, so please make sure you do that. And then what you're going to do is just take the sodium chloride and just throw it in here and toss it. You're finished with that. You won't need to use that anymore. And make sure you put your used syringe in a sharps container. And that can be a water bottle or a milk jug, and you're welcome to bring that to Nava for us to dispose of it properly. So that's all of that. So let's say now you're at the day of your first syringe or your first injection. So what you're going to do is you're going to take your insulin needle and you're going to remove the cap, the cap to the plunger, and you can just toss that. And then you're going to remove the orange lid. And you can see the needle itself is very, very small. It does not hurt at all. You're going to take your alcohol swab and just wipe the top of the rubber. Okay, so basically when you're doing your injections, the prescription is for 17.5 units. It's very difficult to get to 17.5 on here, so because there's just such small differences between the lines. So you're welcome just to take it to 18. So before you insert the syringe into the bottle, draw it back to 18 or 17.5 if you're able to do that. And basically what we're doing at this point is we're injecting air into this vial so that it does not become, there isn't any kind of vacuum that's created. So you have to first insert the same amount of volume that you're going to be drawing out. So you're going to insert 17.5 or 18 units into the vial of air, and then you're going to be withdrawing the same amount of liquid, which is your medication for your NavaRX. Okay? So you just take it very gently and push it in. Turn the vial upside down. Inject the air into the vial, and then slowly pull the syringe back. Until you get it to 18, and if you get too much, like let's say you go all the way down, and you just push it back up. And look for air bubbles. There's some air bubbles right here that I'm trying to get rid of. You just push it back in and then just slowly draw it back again. Okay? And basically that's it. You just pull it off. And then when you're ready to actually do the injection, it's very simple. You just take the alcohol swab and you wipe it on your stomach, and you take your skin and you just squeeze it and just push the needle in and inject the liquid. It's very easy. We suggest that you rotate the site around your stomach over the 2 or 3 weeks, however long your injections are. Okay, hope that helps, and thank you so much, and best of luck on your NavaRX. Bye-bye.